has been working in community optometry for the last 12 years. He received his degree at Aston University in 2012 and has worked at Specsavers in Rugby in Warwickshire. Kunal's main interests include primary eye care as well as glaucomic refinement and cataract post-operative assessment. I know that a number of you go out to the Melin Vaz Centre where you have your annual tests for diabetes. I'm due to have mine very shortly. Kunal looks particularly impressive today. He seems to have an incredible contraption over his head, joining his two ears together. But I'm sure that this is not how you could normally see him at Specsavers. Kunal, thank you for joining us. We know you must be incredibly busy, and we're really grateful to you for coming. You have about 15 minutes to talk to us about this very important aspect of diabetes care, and then we have already got a number of questions lined up for you. So the floor is yours. Welcome to Kunal Solanki.
Thank you very much for that lovely introduction. Yeah, this is just a nice little. Thought I'd give you a little bit something to look towards while I'm rather than all of this. So like Mr. Vaz basically just said, so I work in community optometry. So essentially, the talk today is mainly just about how regular eye tests and basically the importance of maintaining regular eye tests has such an impact on kind of your diabetes management. And basically, to begin with, essentially, kind of how does diabetes affect the eyes, really? So essentially, with diabetes and the blood sugar levels, if they consistently stay high, it starts to affect the small blood vessels within the eye. And the important part is these supply the seeing part of the eye. We call it the retina. Now, in time, if that continues and it's poorly managed, they can start to bleed, they leak, and then that can also cause other issues, which basically can then cause real issues to the sight, the vision, and just in general, really. The key benefit of community optometry is that we can pick up things much sooner, and as a result, we can try to prevent or try to avoid long-term problems. With diabetes, there is a number of different stages. Now, the first stage is, we call it background retinopathy. And essentially, this is normally the point at when we tend to see it in community practice. What tends to happen is you get small, very fine changes at the very back of the eye. Typically, we call them microaneurysms, and it's changes to the wall within the blood vessels. They're very subtle and they require close detail and close kind of monitoring. But this is commonly the case of when we see patients come in, they may be completely asymptomatic, have no awareness that they may even be diabetic. And commonly we will spot just this little blood spot here or there. And that's kind of the prompt at when we kind of decide, when we would normally kind of then refer into to kind of see the GP or see the health practitioner and just kind of get a blood test, kind of just to investigate these signs. If this is again, and then that's kind of that's kind of one of the important things of what we try to do from our side of things. But as well as that, the other part is kind of regular screening and monitoring that. The second stage that comes from diabetes is, we call it non-proliferative retinopathy. Now, in non-proliferative retinopathy, essentially we start to see more hemorrhages or bleeds within the retina. And then along with that, we can also get leakage of fluid. We call it either cotton wool spots, which is kind of a blockage within the retina, or possibly even what we call exudate. So that's leakage of kind of like the plasma. If that continues and starts to cause or continues to cause issues, we tend to find also we can get changes to in the very small blood vessels. So we call it kind of intraretinal microvascular anomalies, which again, all things we don't want. And the problem comes is if we start to progress from the background stage to the non-proliferative, this is when things start to become more serious. essentially, what can that then come with that? And the second stage is where things start to affect the eyes and the vision, or more the vision, should we say. That can progress into, along with non-proliferative retinopathy, we can get kind of macular edema, something called macular edema. And this is essentially kind of fluid buildup within the central part of your vision. Now, the macula is essentially the part in your vision where you see directly straight on. And if that starts to be affected, you can start to notice. Oh, so we can then you may start to kind of notice issues with the clarity in your vision. You may also start to kind of see like a grey spot or kind of part of your vision starting to disappear. That's when things start to get very, very serious, which we'll run through kind of what kind of is done in terms of management on that side of things as well. Along with the stage two, the third stage is kind of the real serious stage. Very poor control can then also start to cause those small changes that we mentioned in the last stage about microvascular anomalies. They can then start to basically cause a reduction in oxygen, changes to the oxygen within the retina. And as a result, the body starts to do something called neovascularization. Essentially, what that does is it creates new blood vessel growth into the retina, the blood, and that can then start to cause bleeding within big bleeds within the retina. The concern with these bleeds is they can cause the retina to kind of start to kind of peel away, can cause issues like detached retinas, and also just what we call pre-retinal hemorrhages as well. Again, all really nasty things which are basically what we class as sight threatening. In practice, if a patient came in with something like that, those are kind of the things which would require kind of emergency referral into the hospital. Those are kind of the kind of big concerns that we have, and hopefully what we hope is we don't want patients to be at that stage. And that's really kind of what the bulk of what we try to do in practice is try to hopefully reduce or kind of prevent patients from getting to that stage. In terms of kind of what we do on a day-to-day practice and kind of how we do to try and kind of prevent this and kind of get to this point. So I mentioned first and foremost the importance of kind of a regular eye test and also maintaining your screening as well. Screening is a fantastic service, and it just makes sure that we have this service available, and it just allows us to pick up on subtle changes, get patients referred, get them into the right systems and areas to kind of be seen. From an optometry perspective, like I say, we kind of do more early detection, so it's kind of picking up on kind of early changes. So background retinopathy we touched on, and those are the kind of common markers that we see, and then we kind of refer in. A common one that we tend to find as well is patients will come in with a big change in their prescription. And this may be something that some of you may have noticed is you suddenly feel as if your vision has either got better or suddenly got worse. And when we see in practice, we often have a look and we kind of say, clinically, it doesn't make sense. Why has that kind of suddenly changed? And this can be really big changes. Oh, sorry. And basically, what we tend to find from that point is usually these will be patients that have got undiagnosed diabetes. Normally, might have quite high kind of blood sugar levels as well. Essentially, what is happening here is the lens within the eye takes on fluid because of the changes in difference in blood sugar levels. As a result, it causes a prescription to alter. So as a result, that causes a change in prescription. Patients start to see sees blurry vision, feels their vision has changed. And that, again, that's something we look to kind of, and something certainly we in practice kind of look for is, why is your prescription changed in such an unusual way? And again, fortunately, that these kind of early stages can be, they resolve. Once the blood sugar's kind of got back to a good level, things are stable, we tend to find the prescription and the vision kind of comes back to what it was pre kind of to a normal level. As well as that, I mentioned about how good screening is from in terms of kind of picking detection, monitoring. and just being able to get patients back into the hospital service if they do need further follow-up. And what we can also do in practice, and this is something I kind of always, we try to recommend it to all patients and kind of just advise us to the benefits of it, is in practice now we have technologies such as OCT, which is essentially what we call optical coherence tomography. Now, what it effectively does is it does almost like a 3D scan of all the layers within your eye. But the beauty of it is, we like to call it like an MRI of the eye, even though the mechanism is a little bit different. But the beauty of it is we can pick up very subtle, fine changes through the retinal layers, and it allows us to pick up and diagnose things like macular edema to a really high kind of level of accuracy. And it just means that if combined with patient screening, regular eye tests, and just being able to kind of, especially with an OCT scan, it just means we can see little changes occurring. And if it does then require patients to then be seen, referred in, it prevents long-term complications. Because the last thing we want is patients having to go through kind of the treatment that, I mean, when it's very poorly controlled and it starts to affect the eyes, we tend to have a lot of other issues that kind of come in with that. You tend to find it can affect, like, again, just quality of life. Vision, we all know how important things like vision are to us, along with all of our other faculties. But just, again, not being able, if you need to have things, if it causes really poor effect to your vision, a damage to your vision, losing your sight, I think we could probably all agree is probably not a good thing, and certainly nothing that none of us would ever want to experience at all. And so that's kind of the main thing of what I like to kind of say is, maintaining a regular eye test means we can pick up so much within practice. We can see so much. Again, we do our best within practice. We try to counsel and just try to kind of explain. You probably, you hear this often, making sure that you've got, knowing your blood target sugar levels, keeping also everything else in check, blood pressure, cholesterol, all of that, and just maintaining a healthy diet. All of that has a really big effect on kind of your diabetes management, your eye health especially. And also then as well, just keeping a regular eye test just means that if something does come up, we can pick it up, we can send it in as we need to. Yeah, I mean, I feel like I'm saying this, I'm repeating myself a little bit there. So
Kunal, thank you.
That's right.
Thank you so much. Thank you so much for that presentation. It was extremely helpful and very well produced, and we're